Are you feeling constantly tired, thirsty, and hungry? Do you have frequent urination and unexplained weight loss? If so, you may be one of the millions of people living with diabetes. What if I told you that there are some vitamins, minerals, and supplements that are beneficial for people who have diabetes? Welcome to Vitality Lab TV, the ultimate destination for those who want to live a healthy life and keep track of their fitness. In this video, we will explore 10 of the most promising supplements for diabetes and blood sugar regulation. We will discuss the science behind each supplement, as well as the potential benefits and risks. We will also guide you on how to safely incorporate these supplements into your diet and lifestyle. So let's get started. Number 1. Magnesium. Did you know that magnesium isn't just an element on the periodic table, but a crucial ally in managing type 2 diabetes? Imagine taking a daily supplement of 250 milligrams of elemental magnesium, which acts as a defender for your blood sugar levels. Research has shown that magnesium plays a pivotal role in enhancing glycemic control for those with type 2 diabetes, improving key indicators like hemoglobin A1C, insulin levels, connecting peptide, and homeostatic model assessment for insulin resistance. But how does magnesium accomplish this? Think of it as the conductor of insulin regulation, expertly guiding insulin activity, glucose absorption, and vascular health. It's essentially the exclusive, all-access pass your body needs for optimal insulin function. When magnesium levels are low, it's like the conductor has gone missing, leading to disrupted insulin activity and a cascade of insulin resistance issues. Number 2. Vitamin D. Did you know that the sunshine vitamin D, might be a game changer in diabetes management? Recent research is uncovering a fascinating connection between vitamin D levels and the control of this prevalent disease. Imagine vitamin D as a key player in the body's metabolic symphony, notably influencing calcium and phosphorus harmony. But that's not all. This fat-soluble vitamin could be a knight in shining armor against autoimmune diseases, including diabetes. It turns out that a lack of vitamin D might set the stage for insulin resistance and glitches in the beta cells, those tiny insulin-producing heroes in our body. Studies suggest that vitamin D supplements could turn the tide, reducing insulin resistance and boosting insulin action and production, especially in type 2 diabetes warriors. This intriguing relationship between vitamin D and diabetes management is a beacon of hope, but it calls for more scientific exploration to fully grasp its potential. Number 3. Chromium. Have you ever heard of chromium, a trace mineral with a mighty role in blood sugar regulation? It's like a backstage helper enhancing insulin's performance, the star hormone in the blood glucose show. Fascinatingly, chromium supplements could be a boon for diabetes patients striving to keep their sugar levels in check. This is crucial, as in diabetes, the body's insulin production or usage hits a snag, causing glucose to accumulate like uninvited guests in the bloodstream. Here's a curious tidbit. Folks with type 2 diabetes often have less chromium flowing in their veins compared to those free from the ailment. Clinical studies have shed light on chromium supplements' potential to lower blood sugar and even cut down on insulin needs in diabetic individuals. Picture this. In one study, type 2 diabetes patients taking chromium picolinate showed improved hemoglobin A1C values, a critical marker of long-term blood sugar control, compared to those on a placebo. Number 4. Alpha-lipoic acid. Alpha-lipoic acid, ALA, a naturally occurring antioxidant, is stepping into the limelight for its potential role in managing diabetic neuropathy and blood sugar control. Think of ALA as a powerful ally, wielding its antioxidant capabilities to alleviate the pain associated with diabetic neuropathy. It's like a secret agent working to delay or reverse the effects of peripheral diabetic neuropathy, with some studies showcasing its ability to improve neuropathic deficits. However, the narrative around ALA is complex, with a mix of studies presenting both significant benefits and less conclusive results. In the realm of blood sugar regulation, ALA plays a dynamic role, impacting insulin sensitivity and insulin secretion. It has been prescribed to patients with diabetic polyneuropathy, thanks to its beneficial effects on nerve conduction and symptom relief. Yet, the story of ALA as an anti-hyperglycemic agent remains partially untold. The current evidence does not paint a complete picture, signaling the need for further studies to determine its role in diabetes treatment. ALA's journey in diabetes management continues, promising yet waiting for more chapters to be revealed. Number 5. Omega-3 fatty acids. Omega-3 fatty acids, those essential nutrients we often hear about, are gaining attention in the diabetes research arena. They have been the subject of numerous studies, particularly for their potential to reduce the risk of developing type 2 diabetes. What's intriguing is that omega-3 fatty acids, especially those from non-marine sources, might be beneficial in combating insulin resistance, a key factor in the onset of diabetes. But there's more to the story when it comes to people already managing diabetes. Omega-3 supplementation in these individuals can lead to a noteworthy decrease in triglyceride levels. This is significant because high triglycerides are a common challenge in diabetes management. Furthermore, the specific composition of omega-3 supplements, particularly the ratio of EPA to DHA, and even the timing of when these supplements are taken could influence their impact on glucose control and lipid levels. Number 6. Resveratrol. Resveratrol, a natural wonder found in the likes of grapes and berries, is making waves in the diabetes community. It's like a versatile tool, showing promise in enhancing glycemic control for those with diabetes. Picture resveratrol as a tiny but mighty ally, boosting glucose uptake and metabolism, shielding pancreatic beta cells, and tackling insulin-resistant, achievements that have been observed in various animal models. The secret behind resveratrol's magic lies in its ability to juggle multiple signaling pathways, especially the SIRT1 and AMPK pathways. This is where it really shines, enhancing insulin sensitivity, reducing blood glucose level and insulin levels, and even alleviating oxidative stress in patients with type 2 diabetes mellitus. But that's not all. Resveratrol also steps up as a defender against cardiovascular complications linked to diabetes, as seen in animal experiments. Number 7. Cinnamon. Cinnamon, that aromatic spice we often associate with cozy treats, has a story that stretches far beyond the kitchen. Harvested from the inner bark of cinnamomum trees, cinnamon has a rich history of medicinal use dating back thousands of years. Today, modern science is catching up, unraveling the health benefits this ancient spice offers, particularly in blood sugar control. One study painted a clear picture of cinnamon's potential. Daily doses of 1, 3, or 6 grams were found to significantly reduce glucose, triglyceride levels, LDL cholesterol, the bad cholesterol, and overall cholesterol in middle-aged individuals with diabetes, all within a span of 40 days. Number 8. Zinc. Renowned for its antioxidant properties and as a key player in insulin management, zinc is a multitasker. It helps to reduce glucose absorption and synthesis while simultaneously promoting efficient glucose metabolism and storage. Do you know how it works? It's involved in the whole insulin life cycle, from its synthesis and storage to its release. It also improves insulin's ability to bind to its receptors, enhancing its effectiveness in regulating blood sugar levels. Acting as a shield, zinc protects cells from the onslaught of reactive oxygen species, which are often rampant in diabetic conditions. Number 9. Berberine. Berberine, a remarkable plant compound, stands out as a beacon of hope in the quest to manage blood sugar levels. What makes berberine so special is its dual action. It not only stimulates insulin secretion, but also enhances the body's responsiveness to insulin. Beyond that, berberine reaches into the energy balance in the body, manipulating key enzymes that steer metabolism, immunity, and reduce inflammation. Number 10. Vitamin B12. Vitamin B12, often hailed for its vital role in neurocognitive and cardiovascular health, emerges as a key nutrient, especially for those battling type 2 diabetes. A deficiency in this essential vitamin is not just a side note, it's a prevalent issue among type 2 diabetes patients. This deficiency can manifest in various troubling ways, including impaired memory, dementia, and peripheral neuropathy, adding layers of complexity to diabetes management. An interesting twist in this narrative involves metformin, a go-to medication for type 2 diabetes. Metformin can be a double-edged sword, as it may reduce B12 levels, particularly with higher doses and in patients. This revelation underscores the importance of B12 supplementation, especially for those on metformin therapy or grappling with a deficiency.